Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery
improve.
of Well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Mallory Jayroe, and she is an infectious disease epidemiology supervisor and the SET-NET coordinator at the Arkansas Department of Health. Thanks for being here.
Yeah, thank you so much for having me. I'm excited to do this.
So tell us about your work. You specialize in congenital syphilis.
Yes, so like you said, I'm the epidemiology supervisor, and in my section, we cover infectious diseases, which does include syphilis. We also include HIV, Hep C, gonorrhea, and chlamydia. But with my program, SET-NET, we're focused on syphilis that affects moms, so congenital syphilis and during pregnancy.
And it is considered an epidemic in Arkansas. Tell us about that.
Yes, unfortunately it is. So in the past 10 years, we had around a 500% increase. And to kind of put that in perspective, congenital syphilis, the numbers have surpassed the perinatal HIV epidemic when we were in the height of the HIV epidemic. So that surpassed the perinatal HIV cases back then. So that's how bad and urgent it is with the crisis we're having in Arkansas.
Is it just Arkansas?
So it's actually all over the United States. Unfortunately, it has hit around almost every single state, but it is kind of the highest in the South.
Is it? And it is preventable.
Absolutely. So, of course, just any other STIs, safe sex, as well as safe sex practices, as well as regular testing. But for women especially, we have a law in Arkansas where you're supposed to be tested in the first and third trimester, and then if not, at delivery. And so with that, we are supposed to be able to catch and treat syphilis. And so this is absolutely preventable, and unfortunately, really sad situation because it's so preventable.
And so babies are being born with it. Are you seeing those numbers increase?
Yes, so those numbers have increased exponentially. There's like a 5-fold increase that's happened in the past even 5 years in Arkansas. And again, this is vertically transmitted, which means it's passed from mom to baby. And with congenital syphilis, why this is kind of like a maternal health issue is because the detrimental effects it has on babies. So they can be born with enlarged spleens. They can have like rashes. And then, of course, the saddest effects, which would be a stillbirth, or babies pass away shortly after birth.
And what does data tell us? Does it say that there's no maternal care, testing just isn't happening?
Right. So it says a lot. And so one of them is no prenatal care. So obviously in Arkansas, it's kind of well known that we have our maternal health deserts, and a lot of women aren't getting prenatal care. And so that's one effect. We're also seeing a high rate of substance use in our cases. So that's kind of increasing the syphilis, and that's kind of what we're seeing in the data.
And you mentioned moms not getting prenatal care. Is it certain parts of the state, or is there data not being collected in certain areas?
Right. So right now our highest cases are in Central Arkansas and Northwest Arkansas, and a lot of those moms are getting prenatal care. But we do have cases all over the Arkansas. But obviously access to care, access to testing, we might not be getting the actual cases in those areas. But for now, we are seeing high rates in Central and Northwest Arkansas.
And there's some stigmas with syphilis and testing. What are they?
Yeah, so like all STIs, a lot of times people stigmatize anything to do with sex and like things like syphilis, gonorrhea, chlamydia. And so with those stigmas, that it makes people not want to get tested, makes people want to talk about their sexual history, as well as defers them from getting treatment. So all those stigmas are really honing in on what's going on in Arkansas.
And so much of this starts with the provider and educating providers. I mean, what do those efforts look like? Right.
So with our program, we are doing provider education because so we had a law passed in 21, and it said that the providers were supposed to test in the first and third trimester, and if not, at delivery. Well, during 21, there was the COVID pandemic. And so I don't know if everyone was tuning in to their legislative sessions then. And so I don't know if we did a good job of getting the word out there. And so now we're having to do a lot of outreach to providers to make sure they know to test in the first and third, because syphilis was actually almost eradicated in the 2000s. So some of these providers are like, I haven't seen syphilis since the early 2000s or ever. And so just redoing that education and letting providers know what's going on.
What do the resources look like?
So we have a bunch of resources. There are a bunch on the ADH website as well as CDC. And then most providers have the Red Book, which is an infectious disease kind of like Bible per se. And it has all the resources for treatment and testing. And so that's something that we really recommend all providers get.
And tell us about pilot projects you're working on. There's several.
Yes. So one of the ones we're currently doing is with the Arkansas Perinatal Quality Collaborative. And they actually came to our Congenital Syphilis Summit we had 2 years ago and saw the numbers and were concerned. So we're doing a pilot initiative for 6 months, and we are testing all moms at delivery. So it doesn't matter if you had all your tests, if you've been treated. If you are delivering in Arkansas, you should be getting a test at delivery. I think there's 22 hospitals participating right now. And this is to catch these babies or these moms who didn't get tested during delivery or during pregnancy or were tested and then reinfected. And we actually have already caught 2 moms who were negative at the first trimester and then were positive delivery. So the pilot is going well, and we're hoping to get our data around like September to report that. So that's exciting.
Very exciting. Tell us what providers need to understand what the best treatment is.
Yes. So with pregnant women, it is penicillin. So that is how we treat pregnant women. Pregnant women cannot have doxycycline, which is the other treatment for syphilis. And if a woman is allergic to penicillin, you do have to desensitize them. And that can be done via a pharmacist. So we do recommend penicillin for treatment for syphilis.
And it's not just women in educating. This affects men too.
Right. So one of the things we're also seeing is that we are seeing providers test and treat women, and they're getting their care, but then their partners aren't getting tested or treated. And so then, they get their penicillin, they go home, and they might, have intimacy with their partners and get reinfected. So if we're not also treating and educating the partners, then we can have reinfection and kind of start all over again. So.
And tell us what the Arkansas law is. You touched on that a little bit. Tell us a little bit more about that.
Yeah, so the Arkansas law currently is you have to test in the first and third trimester, and if not, at delivery. But again, we are doing a pilot, so around 22 hospitals are already testing at delivery. But right now, the law is the first and third trimester. And we want providers to know that, but also women to advocate. So maybe if the provider is unaware of that, the women can also advocate for themselves to be tested in the first and third trimester.
And that even if they tested negative, that it's still so important to do that right at birth.
Yes. And so we encourage testing. We want to, testing for any sexual disease. There's no stigma attached to it. If you have sexual intercourse, you're at risk for any STIs. And so we want to kind of destigmatize that and really encourage anyone to get tested before or after delivery or pregnancy.
And before we close, tell us about the program that you're working on. And there's some exciting things.
Yes. So my program on top of the infectious disease section is SETNet, which is Surveillance for Emerging Threats to Mothers and Babies, which is a mouthful, so that's why we say SETNet, but it's a CDC funded project, and we do enhanced surveillance. So what this program is for emerging threats, and we want to know everything about it. So we already do surveillance on syphilis, and this is enhanced surveillance. So we do medical abstraction, so we get the medical records, we look at interviews from the patients, and really understand what's going on. And that's where we're seeing the substance use, we're seeing mental health issues. And what my program does is we get that data to the CDC, and then they're able to give us resources to do prevention and things like that.
So this is ground floor, information that affects Arkansans at the very, very front of this.
Right. And like I said, we're in a crisis, and it's not gone down in around almost 15 years at this point. And so we want to really get the message out there, because syphilis is very easy to treat and test. It's just doing it. And we want to save the moms and babies of Arkansas with this very preventable disease. And so we hope to continue educating and really doing this work in Arkansas.
Well, Mallory, thank you so much for being here today and talking about this important information.
Awesome. Well, thank you so much.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.